Hey everyone, welcome back. Ready for another deep dive?
Always.
All right, awesome. Today we're taking a look at some really exciting stuff happening in the world of sickle cell disease treatment.
Yeah, there are some pretty amazing breakthroughs happening.
Our sources are all about the latest therapies and advancements, so we're basically getting a sneak peek into the future of SCD care.
Definitely a future that looks a lot brighter than even just a few years ago.
Exactly, and get this, we're talking about gene therapy,
Mm.
new medications with some pretty cool names like voxelotor and crizanlizumab.
Oh, yeah, those are game changers.
And we'll even get to hear a bit about what patients on the front lines of these clinical trials are saying.
Always powerful to hear those personal stories.
Absolutely. So to kick things off, let's set the stage a bit. Our sources start with an overview of the current treatments for sickle cell disease.
Right, because to really understand the impact of these new advancements, it helps to know what the current landscape looks like.
For sure. So what are some of the common ways doctors manage SCD right now?
Well, a huge part of it is pain management.
Makes sense?
Sickle cell crises, they can be absolutely excruciating. Pain relief is just
You
essential.
gotta be.
And then there are blood transfusions, which
Yeah.
are really important for addressing the chronic anemia that's just part and parcel of the disease.
Right, right.
And of course, there's hydroxyurea,
Oh yeah, hydroxyurea.
and it's been a mainstay of treatment for decades.
Really?
It helps reduce both the frequency and the severity of those pain crises.
So these are like the cornerstones of treatment, right?
Yeah,
But you said it earlier, they mainly focus on managing symptoms, not really getting at the root cause.
exactly. And that's why these next generation therapies are so exciting.
Yeah, our sources really emphasize this idea of the future of gene therapy and bone marrow transplants,
Mhm.
which honestly sounds a bit like science fiction, doesn't it?
It kind of does. But that's where we're headed.
Can you break it down for us? What makes these therapies so potentially revolutionary?
Well, they both aim for that root cause, the underlying problem of the disease. Gene therapy, as the name suggests, focuses on actually correcting that faulty gene that causes SCD.
Wow.
Imagine actually being able to edit the genetic code to fix the very source of the
This
disease.
is mind-blowing.
And then bone marrow transplants, they've been around for a while, but they offer a similar possibility of a cure, basically by replacing the source of those sickled cells.
With healthy ones, right.
Exactly, healthy cells from a donor.
So when we talk about gene therapy, are we talking about CRISPR, that gene editing technology you hear about all the time these days?
You got it. CRISPR is definitely one of the techniques being explored.
That's amazing.
It's a super powerful tool, but the real challenge is delivering those genetic edits safely and making sure they're effective and targeting the right cells.
It's like doing surgery, but on a microscopic level, right?
Pretty much.
That's incredible. Okay, so then what about bone marrow transplants? What are some of the challenges there?
Well, finding a suitable donor can be a major hurdle. And then there's always the risk of graft versus host disease.
What's that?
That's where the transplanted cells actually start attacking the recipient's body.
Oh, wow, that's scary.
Yeah, it's a serious complication.
So it sounds like it's this delicate balancing act, right? Making sure the cure isn't worse than the disease.
Exactly. And that's why clinical trials are absolutely crucial.
I was just going to ask about that.
They allow researchers to study these new therapies in a really controlled environment and gather all sorts of data, like how effective they are and what kind of side effects there might be.
So it's all about making sure it's safe and effective before they roll it out more widely.
Right.
Which brings us to those specific treatments I mentioned earlier, the ones with the sci-fi names. Voxelotor and crizanlizumab.
I was wondering if you'd bring those up.
What are they all about? They sound super high-tech.
They are. They represent a whole new class of medications. Voxelotor works in a really interesting way. It basically increases how strongly hemoglobin binds to oxygen.
Okay.
And what that does is prevent red blood cells from sickling.
So it stops them from becoming that sickle shape that causes all the problems.
Exactly.
I see, I see.
Now, crizanlizumab is a bit different. It targets a specific protein that's involved in those sickled cells sticking to the blood vessels.
Oh, okay.
And by doing that, it actually helps reduce the number of those painful vaso-occlusive crises.
Wow, so they're like coming at the problem from totally different angles?
Yep.
It's incredible to see how science is just tackling this disease from all these different directions.
It really is remarkable.
But at the end of the day, the most powerful stories come from the people who are actually living with sickle cell disease.
Absolutely, 100%.
And our sources do mention patient testimonials, which I'm really curious to hear about.
You and me both. Those personal perspectives, they're so valuable.
They are.
They provide that human dimension to all these scientific breakthroughs.
So what kinds of things are patients saying about these new treatments? What
Yeah.
impact are they having on their day-to-day lives?
Well, our sources don't get into specifics, but I can imagine they're sharing stories about, fewer pain crises,
That was huge.
not having to go to the hospital as often, and just, having a better overall quality of life.
That's what it's all about.
Right.
Imagine being able to go back to work or play with your kids or even just live without that constant fear of a debilitating pain episode.
That's the dream, isn't it?
That's what makes all this research so important. It's not just about surviving, it's about actually thriving.
And these treatments are offering that possibility to so many people.
And even though these therapies are still in development, it's got to be so empowering to just have that glimmer of hope.
Definitely. Hope is everything, especially when you're dealing with a chronic illness.
It feels like we're standing on the edge of a whole new era in sickle cell disease care.
I think so too.
We've gone from just managing symptoms to potentially modifying the disease itself.
Right. And that's huge.
So given all these advancements, what do you think the future really holds for people with sickle cell disease?
Well, honestly, I believe we're entering a time where a cure for SCD might actually become a reality for many people.
Wow.
Just imagine a future where kids born with this disease, they can actually look forward to long, healthy lives.
Free from all the complications.
Exactly.
That's a really powerful vision.
It is.
And for anyone listening who's interested in learning more about the specific treatments and research we've talked about, I definitely encourage you to do some digging.
Yeah, the more we know, the better equipped we are to advocate for progress and support the people who are affected by this disease.
And that's the point of all of this, right? To
Mhm.
spread awareness, to educate ourselves, and to ultimately contribute to a future where everyone has the chance to live a healthy and fulfilling life.
Excellent.
So on that note of hope and discovery, we're going to wrap up this deep dive. But keep those minds curious and those hearts open to the wonders of science and the incredible resilience of the human spirit. We'll see you next time.
See you then.